Now, 3 indicators I said we would roll out today, and you can see them live right now at nyc.gov/coronavirus. I'm going to go over them, but again, this will be information that's always available to you, updated daily, and we'll all watch the progress together. And I want to note right there, I want it to be steady progress. We all want it to be steady progress. It may not always be steady progress, stating the obvious. Sometimes the numbers may go up, sometimes down. We want it to be down a lot, but we can't guarantee every day is going to be perfect. Sometimes one will go up, another one will go down. We got to see them all move down in unison over a prolonged period of time to be able to get to that next phase where we have low-level transmission and we can start on the path to a more normal life. So let's go over these indicators. Number 1 is the daily number of people admitted to hospitals in New York City for suspected COVID-19 conditions. So again, we're going to show you the progression from day to day. And the data, I should tell you up front, is typically about 48 hours lag between when the information that we're talking about, when the actual admissions to the hospital or the ICU, et cetera, when it happens and when it's reported. And that is because different hospitals report at different times in different ways, and our health department has to get all the data collected and consistent before it's published. So there will be a lag. We're always going to see if we can reduce it, but for now, assume about a 48-hour difference. But it's still going to tell us what we need to know. So for April 11th, that is Saturday, you have 383 people admitted, new hospital admissions for suspected COVID-19. The day before, that was 463 people. So that's a really meaningful improvement. That's a step in the right direction. The second number, daily number of people in the ICUs across our health and hospitals, that's 11 hospitals, public hospitals, the number of people in the ICUs for suspected COVID-19. So again, going back to April 10th, 857. By April 11th, Saturday, 835. Also moving in the right direction. And then the third indicator, the percentage of people who tested positive for COVID-19. So again, that number, going back to April 10th, 59.3% citywide. By April 11th, 58.1%, moving in the right direction. And then a very specific subset of that, the tests done by our public health lab, and they focus those tests specifically on a certain type of case, and Commissioner and Deputy Commissioner can go over that in detail in a moment. There we see the public health lab testing, again, the same good pattern. April 10th, 80.5% of those tests were coming back positive. By April 11th, 78.4%. So day one of this new effort, I'm pleased to report we do see all the indicators moving in the right direction, moving downward together. This is a very good day. This is day one. Now we got to keep working all together to keep these numbers moving in the right direction. And I want everyone to take it personally. I want you to feel like when you see these numbers are abstractions, but they represent human beings, and they represent the future of the city and what our lives are going to be like. When you see these numbers, take it personally. Recognize this represents the progress that you have achieved, but we've got a lot more to do to keep that progress going, to get to the point where we might be able to ease some of the restrictions and move towards normalcy and have a low transmission dynamic with COVID-19. And I always will keep saying, if we don't get it right, or God forbid this disease resurges, we're going to have to potentially tighten restrictions further. So we don't want that to happen, obviously. Best way to avoid that is to stick with what's working and keep our discipline, and New Yorkers have been absolutely outstanding.